Hello New Era University students, I'm Sir Prince. Today we will discuss about the non-communicable diseases, also known as chronic diseases, are those diseases that are not passed from one person to another. The most important risk factors include smoking, blood pressure, unhealthy food diet, inactivity, overweight and obesity, diabetes and blood sugar and alcohol. Let's start in diabetes, a disease in which the body produces little or no insulin or cannot properly use the insulin it produces. The symptoms of diabetes vary depending on how high your blood sugar is. Many people, particularly those with prediabetes or type 2 diabetes, may not feel symptoms at all. For type 1 diabetes, symptoms appear to develop rapidly and are more severe. Allergies, a condition in which the immune system becomes hypersensitive to something in the environment such as dust mites, molds, plant pollens, food, and even to medicines. Symptoms are sneezing and an itchy, runny or blocked nose or allergic rhinitis, red watering eyes or conjunctivitis, wheezing, chest tightness, shortness of breath and a cough, a raised, itchy, red rash or hives, swollen lips, tongue, eyes or face, tummy pain, feeling sick, vomiting or diarrhea, dry, red and cracked skin. Asthma, a chronic lung disease in which the passageways that allow air to enter and leave the lungs are inflamed and become narrow. Symptoms are chest tightness or pain, coughing or wheezing, attacks that are worsened by a respiratory virus, such as a cold or the flu, wheezing when exhaling, which is a common sign of asthma in children, trouble sleeping caused by shortness of breath, coughing or wheezing, shortness of breath. Cardiovascular disease, a disease of the heart and blood vessels. This may include coronary heart disease, which occurs when coronary arteries are narrow or blocked by waxy substance referred to as plaque. Symptoms are pain, chest tightness, chest pressure and chest discomfort or angina, shortness of breath, weakness or coldness in your legs or arms if the blood vessels in those parts of your body are narrowed, pain in the neck, jaw, throat, upper abdomen or back, and numbness. Cancer is a group of diseases in which cells divide in an uncontrolled pace. The symptoms are wrote in acronym form of CAUTION. In short, caution: C. Change in bowel or bladder habits. A. Sore that does not heal. U. Unusual bleeding or discharge. T. Thickening or lump in breast or elsewhere. I. Indigestion or difficulty in swallowing. O. Obvious change in a wart or mole. N. Nagging cough or hoarseness. Arthritis, a painful inflammation of joints that affects the muscles, tendons, and ligaments surrounding the joints. The symptoms are restricted movement of the joints, joint pain, tenderness and stiffness, inflammation in and around the joints, weakness and muscle wasting, warm red skin over the affected joint. Renal failure, also known as kidney failure, is a condition where the kidney stops to function properly, causing renal insufficiency. The symptoms are shortness of breath, decreased urine output, although occasionally urine output remains normal, causing swelling in your legs, ankles or feet, fatigue, fluid retention, confusion, nausea, irregular heartbeat, weakness. We can avoid these kind of diseases if we have healthy lifestyle and self-monitoring skills, where we will discuss on the next lesson. Kindly click the button to get back on your module and answer your today's assessment. Thank you for your time to listen. Keep safe and you, students.